have you ever heard of hippotherapy or horse therapy or equine therapy? And they go, yeah, I think so. So-and-so does that, I think. Okay, great. So you know how they use the horse to provide therapeutic benefits? And they're like, yeah. Okay, so we just use the trampoline to improve therapeutic benefits and outcomes.
I love it. And it's not a replacement. It's a side-by-side thing. So as soon as I read that post, I'm like, okay, I can see these correlations here because I have witnessed firsthand the hippotherapy and how that works. And a lot of the clients that are coming to that, this is an adjunct. This is a portion of what they're doing. This adds to their life. They enjoy it. They want to come and see it. So, it's just that additional piece that kind of goes along with it to give them that extra boost. And like you said, the biopsychosocial model is absolutely in play with hippotherapy. And it sounds like the same occurs with rebound therapy. Hey everyone, welcome to PTA Plus Podcast. This is Katie Sutton, your host. I am super excited. See, I'm so excited I can't say one word at a time. I'm super excited for you to meet our guest today. Her name is Sigourney Weathers, and Sigourney is a physical therapist. Yes, this is PTA Plus, but we also talk to physical therapists too because they're doing some really amazing things as well. And Sigourney is going to tell you all about rebound therapy today. Sigourney is not only a physical therapist, but also she is an instructor and trainer at Rebound Therapy USA. And so she's going to tell us what that is. I am going to just ask the questions. Because I didn't know what rebound therapy was until we brought her on the show. So I'm really excited for you to hear about what she's doing. She is a physical therapist plus. She is a CrossFitter. She is a wife, a mother. She's a gymnast. Those silk aerial things that gymnasts do? She does that too. Really cool stuff. You also get to hear a little bit about my hula hooping, my previous hula hooping experience. Which I'm sure that you have just been dying to know. Anyways, I can't wait for you to hear the information that Sigourney is going to bring to you today. So without further ado, let's go ahead and bounce to this episode. Thanks. Hi, Sigourney.
Hey, Katie, how are you?
I'm doing great. How are you doing?
Hello, I'm fine. Thanks.
That is awesome.
That was scary.
Is that scary? That's great. We're keeping it.
I am great. How are you?
I am doing good. Thank you. That was the best way to start the podcast off, and I love it. So I don't know when this podcast will be released, but it's October 1st where I am. So we have officially entered PT month. So happy physical therapy month.
Yeah, I'm excited. There's a lot of other things going on this month too. So
yeah, definitely. So Sigourney, I'm just going to go ahead and let you introduce yourself to our guest. We're really excited to have you. You have come to talk to us about rebound therapy. But before we dive into some of that, why don't you go ahead and give us a little bit of your background and who you are?
Okay, yeah. So usually I'm really long-winded with this, so I'm going to try and keep it concise. I'll give you my overview first. And what I do now is I equip professionals and PTs, OTs, anybody with the knowledge and skills to implement therapeutic trampoline techniques. And so we'll go into what those are. But how I got there is pretty cool. I was a gymnast throughout my entire life. I dove into the tumbling and trampoline side of things. Did a little bit of aerial silk in there. And then my rheumatoid arthritis got so bad that I wasn't able to say, oh yeah, I can be at this gig or this show on this day and know that I will be 100% okay with that. So I decided that it was time to go the physical therapy route and not join the circus, which I really wanted to do. So yeah, didn't join the circus. And went the physical therapy route and thought I would do ortho, PT, and work with gymnastics athletes, and found that my background in working in recreational gymnastics was more my thing. And that very much tied into pediatric physical therapy. And so that is the route I decided to go. But then once I got there, I found that there was a gap or a lack in recreational services for my clients. Once they graduated PT, they all wanted to just like stay. They wanted to stay with me. Well, no, we're not ready. Well, you are ready, but I understand that you're having trouble finding these supportive services in our community. And so that kind of led me to do some searching on like what other things in the community there were for my clients. And I stumbled across this thing called Rebound Therapy, and quickly got certified because it was trampoline and therapy all in one. And I was like, this is totally me. And everything just kind of snowballed from there. And a couple years down the road, I created my own company and bridged the gap between therapy and trampoline and gymnastics.
That is incredible. So do you mind sharing the name of your company?
I have a few.
Okay.
So the company that I used for my brick and mortar location was Balance Creations Physical Therapy. And so that was my brick and mortar location. I've since kind of closed the doors on that just because the gym that I was renting space from closed, which is a family gym. So we closed that. And so that kind of opened up some time for me to really promote what I was doing and teach everybody the benefits of using trampoline and gymnastics as this therapeutic tool, and where it can do and what you can do in the community with it. So now I run Rebound Therapy USA.
Okay. Yeah. And that's what I think that's how I connected with you through social media. As a matter of fact, I think you posted on another group page and I replied, I can't help you. I forget what you were asking for. I'm like, I can't help you, but I need to know what rebound therapy is. So that's how we ended up, getting hooked up for this conversation. So I'm like, I can't help you, but I need to know what this is.
Yeah, no, I love that. And I reach out to so many people on social media, so I don't know exactly which post that was. But yeah, we definitely connected on social media.
Yeah, definitely. Social media is a great place to meet people. So you have some really cool things going on here. Now, you and I have some connections. You're from Carrollton, Texas area, and I'm from Carrollton, Ohio area, and we just kind of discovered that recently. So that's one of our connections. I noticed that you like to hula hoop. So I am one of the reigning hula hoop champions from my previous employer. I don't know if anybody has taken over that reigning hula hoop champion. We also have a hula hoop competition at my family reunion every year, which is kind of fun and interesting. Somebody sabotaged me one year, so I lost. And then my youngest son won this year. So yeah, I know it's a real bitter subject. I won't talk about it. But
My almost 3-year-old just started like actually trying to hula hoop, and he finally got it around like 3 or 4 times. So I was like, "Go, Kaylin! Yes!"
yeah. Yeah, it's really incredible to watch them whenever they really get it going. My son, I forget, I mean, he was like minutes, like it was like a really long time that he was going, and we were all kind of just tired of watching. So we're like, okay, so you win, like you might be able to go longer, but we're just gonna go ahead and give you the title, buddy. So
You'll need to add multiple hula hoops next time,
there you go.
or like
Yes.
hula hoop on an arm and the stomach, or like 2 hula hoops on the stomach. Change it up.
Yeah, we're gonna have to like increase it because he's definitely past level 1. So we're gonna have to figure out something else with that. But
Yeah.
okay. So many things that we have in common here, but something that I ask every guest that they come on the show is if you could finish the sentence, I am a physical therapist or physical therapist assistant. In your case, you're a PT. So if you're going to finish the sentence, I am a physical therapist plus, what else would you use to fill in the blanks?
I'm a rebound therapist. I am an inclusion and disability advocate. I am a wife, a mother, a CrossFitter, trampoline enthusiast, gymnastics expert. I love to cook. That is my love language. So if I cook for you, I love you. And I love to walk and swim and hula hoop and do all the aerial circus stuff.
That is
Um,
great.
yeah.
Awesome. So when you say aerial silk experience, is that like the silk, like the rope that you can like swing on? Like, is that what you mean?
Yeah, so the fabric that hangs from the ceiling, a lot of people call it fabric. And so it's a lot of the times in Cirque du Soleil. So there are actually PTs that work at Cirque, and they work with the performers. But a lot of those performers will do trampoline or aerial ring, lyra. But yeah, I climbed a fabric up to the ceiling and then wrap myself up in it and then fall to the ground
That's
safely.
amazing. That's amazing. So that is something we don't have in common. So
Yeah.
yeah,
Yeah, it's
great.
it's becoming more common though in the DFW area, and I'm so excited for it because it's accessible to everybody now. And just like trampoline, we're trying to make trampoline and gymnastics accessible to everybody, and so I think we're all going in the right direction.
Well, and I'm really excited because some of the words that I've heard you say and that you and I have had in communication so far, things like empower, inspire, individualized, inclusive. And I just think that that's amazing that you're kind of providing a route there for people. You want them to all have the ability to have the same experience that anybody else does. And so that's pretty incredible. And so it's neat that you're kind of bridging that gap between your therapy, your physical therapy background in this new rebound therapy background. So I know you've kind of started explaining this to us a little bit, but I knew that if I didn't know what rebound therapy was, I'm positive that there's other people who don't know what rebound therapy is. So can you take us on a little bit of a deep dive here into the background of rebound therapy and what it is?
Yep, I will start with a short sentence, and then we can kind of dive deeper. So rebound therapy is using the trampoline as a tool in order to improve strength, coordination, balance, and then we get into flexibility, and then also cognitive development and speech development, social skills. All of those play a big role in rebound therapy, and we use the techniques of this program to promote that.
So really looking at that biopsychosocial model, like you've got all three of these things working hand in hand in rebound therapy.
Yep. And I did leave off one, cross curricular learning. So this can actually be put into school systems or even like special needs schools, or we're looking public schools as well. And this can be put into the curriculum. And then you can come on the trampoline and do your math lesson on the trampoline, or your reading lesson or your direction lesson. So I think that's the thing that I love most about it is the learning aspect.
Yeah, that's so cool. And I'm sure that your clients and patients appreciate that part, that there's multiple aspects to it.
Yes, and I think as a therapist, I enjoyed it because then I can bring in my speech language pathologist and my OT and all the other team members on this and be like, hey, what are your goals? I want to work on those goals while I work on the goals I'm working on in PT. So we can just more collaborate, or like if they're wanting to use the trampoline in their session, I can say, oh, this is what we're working on PT wise. So you can do this activity on the trampoline while you're doing your speech stuff or while you're doing your OT, sensory regulation, whatnot.
Yeah, that's great. So, like, where did you stumble across this? Like, how
Yeah.
how did you jump in to rebound therapy?
Yes, yes. Definitely
Absolutely
jumped.
intended.
Definitely jumped. We jumped across the ocean to the UK. I did not actually go to the UK. They had an online training course, but rebound therapy started in the UK in 1970s. The founder was Eddie Anderson,
Hmm.
and he was a physiotherapist and trampoline coach. And he kind of saw the same thing that I did and actually brought it into a program. And he coined the term rebound therapy. And it's since kind of flourished over there. And then in 2019, they kind of brought it over here. It was me and one other trampoline coach that latched on. We're like, this is what we're doing. This is what we want to do. And so we got certified and then certified to teach this as well.
So, what does that certification look like? And are there some things that you should kind of have lined up before you choose to do something like this? Um, your
Yeah.
backgrounds, your skills, how does that
Yeah.
all play in?
So the only thing you really need to have lined up is that you have a a regular size trampoline, which is like a 6x10 or 7x14 trampoline. That's what this program does. There is another program called FlexiBounce that we won't dive into today. And if people have questions, they can, come talk to me about it. But FlexiBounce is using a rebounder, an orthopedic rebounder. So it's the small, like what we would consider a mini trampoline, right?
Okay. Yeah.
So those are actually called orthopedic rebounders. Okay. So I'm off my deep dive somewhere else, and we're going to come back to
Totally fine. I'm sure somebody would have asked.
Yes. So the course can be taken online or in person. A lot of the times I find that online for therapists is just fine, but you just need to have a trampoline, a regular size trampoline that you're able to use on a weekly basis and practice some of these techniques, and then eventually work with your clients. 12-week course that it's kind of self-paced, but we also have coaching calls during that. So we have weekly coaching calls. So you get like face-to-face, like what we're doing now, or if somebody wants to call in, whatnot. We have coaching calls. We have community groups where they can ask questions. But we go through all the safety. We go through the background and history of rebound therapy. And then we actually go into the techniques, the program. And then we talk about what I love for therapists is the Huddersfield Functional Index. And that is an outcome measure. And so this is something that you can give to insurance agencies and say, hey, they are making progress. Now, we don't have a lot of research on it yet. So we don't have like norms and all of the things we like need for insurance companies, but at least it's something that we can give them numbers on, and they appreciate that. Just so we can prove that, yes, there's a reason we're using a trampoline and it's not just sensory regulation.
Yeah.
We all know that insurance does not pay for that. So those are kind of my,
Yeah. So what makes physical therapists and physical therapist assistants or any other medical professional, like what makes them a good fit for this, or are they a good fit for this?
yes, absolutely a good fit. And so like we just have that background knowledge of like developmental, like how we develop and those functional skills. And that's what we're teaching in rebound therapy. We're teaching the developmental skills and we're teaching function. So where do we all start when we're kiddos? We start on our backs and in prone. So that's where we start with most of our clients. And then we have to decide, why are we doing that? Are we doing it for sensory regulation? Are we doing it for relaxation so then we can stretch muscles? So there's the why behind it. And physical therapists and PTAs and OTs, right? Recreational therapists, everybody that is in the therapy community is taught to understand and break down that why, and why are we doing it, and then build upon that. And so this program breaks that down and teaches you some of the whys behind what we can do on the trampoline. Because I think everybody knows a lot of the things we can do on trampoline, but they're not sure of the why. And so in order to put that into our goals and be able to, actually utilize the trampoline during our sessions, we have to be able to prove it. And this, being a physical therapist or a therapist in general, allows you to do that.
Yeah, absolutely. So are you finding that, I guess what I should ask is, are you having any luck with getting insurance companies on board with this? Because I know you said that you're starting to get some outcome measurements and starting to kind of establish those maybe norms for this type of service. And I think that we all know that research takes a really long time to actually hit the general public. So it could be years before data and research actually gets out about this. But are you finding that there's insurance companies that are willing to kind of jump on board with this? There, I said jump again. I'm not trying to like make these puns every time, but
That's okay.
but it fits.
Yeah. So let's start with, we'll start with the health insurances. So when we submit claims, I have no problem with that. I did that for 3 years, submitted all of my claims, and I was in network. Like cash-based PTs are not going to have any issues. But I was in network, had no pushback whatsoever. But all of my goals were functional, and they had reasons why we were doing that. And I did have some goals that were specific to the trampoline, but I had other goals that were not. So there's that. I didn't have any issues with insurance on that side. Business insurance, on the other hand, we have to just make sure that it is in our insurance that we can use trampolines in our therapy sessions. So some insurance providers say that anytime your feet leave the ground, we're not going to cover it. And as a pediatric PT or an OT, my clients pick up their feet all the time.
Yeah, I was just going to say.
If I'm teaching running, their feet should be off the ground. If we're reaching, our goals of running, we should have that flight phase in running. So you just want to make sure you understand what your professional liability insurance is covering. And that's just what I tell everybody. But as long as that gets covered, you don't have any issues.
Yeah, that's interesting. Now, did you have anything to add on the research part? Like, do you know if that's coming about, or have you seen any new research kind of come out about these types of adjuncts?
Yeah, a lot of it's case studies right now. So we are in that phase of case studies, and we just need a couple more people to latch on and be like, okay, yes, let's get a group of people together and let's do this. But we just haven't quite gotten there yet. I did get certified in 2019, and so COVID hit right after.
Yeah.
And so we kind of had to lock down and be like, let's just do what we know how to do right now. And then once we kind of get out of all of this and we're moving forward, then we can move forward with more. So I think that we're going to see that growth and that movement forward. But COVID just kind of took us a step back.
Yeah. As did just about everything else with COVID, right? So,
but
go ahead.
The great thing about COVID was we all learned how to use technology and harness it and get our information out there. So I feel like there was positives and negatives. I try to look at the positives of everything and make sure that, we're learning from every situation and finding those good moments.
Absolutely. I think that anybody who was able to look at it from your perspective and kind of take those goods with the bads, there's a lot of things that we were able to kind of push forward after that are going to stay forever because of COVID. So yeah, I think you're right. We have some things that we can be grateful in regards to what we've learned from that dreadful time period of everyone's life. But so Rebound USA, am I saying that right?
Rebound Therapy USA.
Rebound Therapy USA. Now, is it in other places right now? Is this a single facility? Are you gaining traction in other cities? Do you know where that's kind of leading in the future?
Yeah. So Rebound Therapy USA is just the training portion. So we don't have a brick and mortar location. That was my other company. So I just do the training. It is only me and one other a gymnastics coach that does the training. So I do most of the PT side, OT side, all of that. And so we have one other OT up north that just got certified. And so she's super excited to get started. Everybody else has been more of along the gymnastics track.
Okay.
We do offer this course for gymnastics coaches as well. But PTs also kind of get something extra out of it.
Gotcha. Yeah. So I read on one of the Facebook posts from Rebound Therapy USA that there are some similarities between rebound therapy and hippotherapy. Now, hippotherapy, I'm pretty familiar with. We have a couple facilities close by to where I live. I have volunteered there before. It's something that's near and dear to my heart. I love it, and I agree with you. I think that you had told me that if you weren't doing any of this, that you would enjoy horseback riding and therapeutic riding and things like that.
Yes.
So that's also something that I would love to do. And I'll say if I ever win the lottery, then that's what I'm going to do is open up a hippotherapy clinic or a therapeutic riding center. So, but anyways, can you explain to us how those two kind of cross over and some of those similarities that you see between the two of them?
Yeah, of course. So this is actually a way I figured out how to explain rebound therapy, because obviously, as we all know, this is new to the US and everybody is saying, okay, explain rebound therapy to me. And I would spit off this long list of everything. And I was like, no, this is not making sense to people. And so how I explain it now a lot of the times is, have you ever heard of hippotherapy or horse therapy or equine therapy? And they go, yeah, I think so. So-and-so does that, I think. Okay, great. So you know how they use the horse to provide therapeutic benefits? And they're like, yeah. Okay, so we just use the trampoline to improve therapeutic benefits and outcomes.
I love it. And it's not a replacement. It's a side by side thing. So as soon as I read that post, I'm like, okay, I can see these correlations here because I have witnessed firsthand the hippotherapy and how that works. And a lot of the clients that are coming to that, this is an adjunct. This is a portion of what they're doing. This adds to their life. They enjoy it. They want to come and see it. So, it's just that additional piece that kind of goes along with it to give them that extra boost. And like you said, the biopsychosocial model is absolutely in play with hippotherapy. And it sounds like the same occurs with rebound therapy.
Yep. And I love that you said that, they enjoy it. They want to come. It's the same thing with trampoline. I have met very, very, very few people who ever tell me, no, I don't want to go on the trampoline. You say, do you want to go on a trampoline? They're like, yeah, let's go. Even an adult, they're like, yeah, let's go.
Mhm.
Even if they may
Sounds
be a
like fun.
little scared, you can say, okay, I can help you through that. If I've seen like a 97-year-old be a little nervous to get on trampoline, but because we had the training through Rebound Therapy, she was like, okay, yeah, I'll get on with you. And so it's not always bouncing. But what was I speaking to? I lost my train of thought.
So, yeah, we got so many things going on here, right? Well, we were talking about hippotherapy and enjoying coming to therapy.
Oh, yes, enjoying. So
Oh,
it's
yeah.
motivating. It is one of the most
Oh,
motivating
yeah.
tools to use. And so I find that if I have a client that is not motivated to do anything else during my therapy session, I'm getting them on a trampoline and
Mhm.
just going, here, take 5 to 10 minutes to bounce. And so I can figure out what you like and what motivates you. And then we can regroup and move forward.
Yeah, absolutely. And that's such a key part of any of our treatment, no matter what therapeutic setting we're in, is finding that motivation and finding what is going um, to get that patient hooked to what they need, and how we can help them in incorporating their thoughts and their values and make it individualized for them. So that's all part of what we do anyways. And it sounds like this is a great way to kind of incorporate what they like to do as well.
Yes, exactly.
So you did mention something about, I think you said one of your clients was in their 90s. Is that what you said?
Yes, yes. It
So
wasn't
this
my
is like the whole spectrum here.
Yes, we are talking full age spectrum, 0 to however old that person is. You can get them on a trampoline safely and find benefit in it. And so this was not my personal client, but it was our other trainer's mom. And so she was 97 a few years ago. She's actually turning 99 in a couple days.
Wow.
So she will get her mom back on trampoline and they'll do something. And so if you follow our Instagram, I'm sure we'll have something up there about it when she gets her on the trampoline again. And so 99, going to be on the trampoline, but she was 97 at the time. And she was walking on the trampoline. We were doing quadruped and riding the bed. So she's getting some proprioception through the arms and the legs and the hips, getting some core strength as well through that quadruped without having to, move or walk or, lift an arm or a leg. And then also some relaxation on her back, things like that.
That's pretty incredible. And when you say relaxation, like I guess I didn't really like think about that, but have you ever just like laid on a trampoline? Like just laid down on a trampoline? Like there's something that's kind of freeing about it that you
Yes.
just kind of feel like you're on like a cloud.
So my favorite thing to do it's actually one of the activities in our rebound therapy program is to put a parachute on the trampoline, lie down right in the middle and have somebody else, what we call ride the bed. And so that's pushing down into the bed at a slow rhythmic movement. And so you're getting this like ocean feeling, and then you're also hearing and seeing the parachute kind of come up into your eye view and then come back down. And it is one of the most relaxing things ever. I haven't had anybody do it for me in years, but you just remember that feeling for your entire life. And that is what I find a lot of people love.
That is awesome. Any other kind of interesting techniques that you want to share or tell us
Yeah,
about?
I'd love to.
Yeah. Okay.
Um, so you can actually work underneath the trampoline bed and provide some extension throughout the thoracic spine and the chest, or even like do some hip mobilization. Not mobilization, I don't want to call it that, but you're creating some rotation in the hips. So almost like a walking pattern. You can help them feel that while they're laying down on the trampoline. So that's one of the cool things about it is I love to work underneath the bed for specific clients. And then the other amazing thing about trampoline is that you can get somebody to move, stop, or go without touching them. And that is like the most amazing thing for trampoline is because some people don't want to be touched, and some people you want them to feel like they are doing this all by themselves and get the confidence and gain the confidence to say, I can do this. But they may need just that little extra help. And you can provide that through the trampoline bed without even touching them.
That's pretty incredible.
Yeah. So
Yeah.
those are some of my main things that I like to talk about and that are very unique to trampoline.
Yeah, definitely. I like how you said that getting your client or your patient to recognize there's something that they could do that maybe they didn't feel like they could. I always found that to be one of the exciting parts about doing aquatic physical therapy. I did some aquatics, and I found that really cool when a patient would get in the water and they were more weightless and they felt like, hey, this is the first time I can take a pain-free step in a long time, or this is the first time I've done X, Y, and Z. And it's just really empowering for that patient to feel like I have this little bit of freedom, a little bit of freedom that I haven't had in a long time. And I think that that's just really encouraging to that patient and makes them want to come back and
Yes.
feel good about themselves. And yeah.
Yeah. Yeah. And I love the word freedom too, because there is a point at the top of a bounce. It doesn't matter how high you're bouncing, but at the top of a bounce, you become weightless. And
Hmm.
so for people who haven't felt that in a really long time, let's think about people who have spinal cord injuries or in wheelchairs. They have not felt that in a very long time. And so like to get them on that trampoline and allow them to feel that weightlessness is like freedom.
Hmm. Yeah, definitely. So who's a good fit? Who's a good fit as far as maybe a client that's thinking about coming? Um, are there like any hard rules on this? Is it kind of like, let's see what you got and what you can do? And
Yeah, the person who is the best fit is whoever's motivated by trampoline, first of all. There are 6 contraindicated diagnoses that we do not suggest getting on the trampoline. And so those, I usually forget one. I'm going to tell you all right off the bat. Number 1 is pregnancy. And I will tell you that I personally jumped while I was pregnant. I got that cleared by my doctor, but that was something like running where I had done trampoline my entire life.
Mhm,
And
yeah.
so I knew my limits and I knew that my body was changing. So I wasn't doing like backflips and back handsprings. I was just doing my rebound therapy techniques and riding the bed with some of my clients.
Gotcha.
So anyways, but pregnancy is definitely one of them. We don't want to get anybody else on the trampoline while they're pregnant. Osteogenesis imperfecta, so like a skeletal dysplasia, which leads into dwarfism. That's another one. And then detaching retinas. So if that's obviously a medical emergency.
Mhm. Yeah.
And then kiddos with Down syndrome, if they have the AAI instability. Now, if they don't, then we can definitely allow them to get on the trampoline, but we
Okay.
do have
Yeah.
to be cautious and just look for those red flags. And then, yeah, I'm forgetting the last one like usual. But
They can check out your website to find out more, right? Yeah, those were all ones that I kind of figured might be on that list. So that's good information to know. So, can you tell our audience a little bit more about where they can find you, where they can find out information about Rebound Therapy? Do you have websites or Instagram? I think that you're on Instagram, right? Instagram and Facebook, both?
Yeah. So I actually got a comment from another coach the other day, and she was like, "Do you ever sleep?" I'm like, "Nope." And that is because we're on Instagram, Facebook, LinkedIn. We have a website, and I'm running, and email marketing. So
Yes.
we're doing all the things. So you can just find us pretty much anywhere, and
Great.
just type Rebound Therapy USA into Google, and we come right up.
Awesome. I've definitely found that, I mean, I'm a fairly new podcast, so I'm finding out all the extra things that go with it. It sounds really cool to like have great conversations with people and just, chill and talk. But then there's all the other things that you do on the side that I'm learning so much about it, and editing and YouTube and Instagram. Like I never used Instagram that much. There's things that I don't even what's the difference between a reel and a story? Like, I don't know these things. Like, I need somebody to coach me through this.
Yeah, and so I actually hired a coach to help me through that.
I might have to do that. So send me your coach's name.
Okay, cool. What was I going to say? But yeah, I mean, it's a whole new world, and you're learning a whole new set of skills. I love that you're doing this. I mean, podcasts are much needed, and all this social media is needed in these days. But it is like going to school again and learning all of these things.
Yeah, definitely. Well, and the big reason why this podcast kind of came to be is because I wanted to highlight all the additional things that we do aside from being a physical therapist or a physical therapist assistant. So many PTAs, when they introduce themselves, they make the mistake of saying, I'm just a physical therapist assistant or I'm just a PTA. And I'm like, stop, throw
Yeah.
that word out. That is not true. We are physical therapist assistants and physical therapists, and we should be proud of the work that we've put into what we do. But also, there's so many other things that we do that make us who we are. It goes beyond that degree. It goes beyond that clinical setting. There's all these different things that we're doing for our community and to improve ourselves, to improve the lives of our patients, that we kind of forget to highlight those things from time to time. So I just want to bring these stories forth because I think there's so much people have to say out there, and I just want to highlight those areas.
Yes, I completely agree with you, and love that you do that. Every time I reach out, like on an Instagram or a Facebook group or things like that, just can make these connections. I'm like, oh my gosh, you have so much to say about this. Like, I want to learn more from you as well. So it's really cool that we have this and we have all these platforms. So thank you.
Absolutely. Yes. And I just hope that there's more and more coming. So, I don't know, maybe that's your next step whenever you have some free time is to podcast about rebound therapy
It's in my brain. It's
in your
probably in the
spare
middle.
time. Yeah. One
It's
step
been
at a time. The
yeah.
important thing is you hit the start button. And I think that that's what a lot of people are hesitant on is just hitting start, and you got to start somewhere.
Yes, and that's what we hear the most. I'm fearful. We hear that a lot from gymnastics coaches more because therapists are like, oh, yeah, I got this. I work with this population all the time. But still, there's a little bit of fear in that. And so we're also here to provide that confidence. Like, you can do this. You got this. This is not rocket science. So,
Yeah, definitely. Great. Well, one thing that I always like to ask our guest on the show is what your plus point is. So, do you have any wise words of advice or call to action or anything that you would like to leave our audience with today? Because you've already taught us so much. That's one of the things that I consider myself very lucky is I get to have these conversations because I didn't know about rebound therapy, but I got to have a conversation with you about rebound therapy.
yes, I think my thing is, reach out and just start to talk to people. Um, do that networking. And I feel like the more I've networked and the more I've talked about this, the more I know and the more I understand. Um, that's kind of just from our conversation. But in general, my plus point is it's so hard because there's so many things to say. Um, but you can do this. You can be a trailblazer and foster inclusivity in your community, and it's not hard. We just need to start, and that's what we're lacking in is the gap between therapy and the community recreation program. So it doesn't have to be rebound therapy, but find something and make sure that you have those connections in the community to send your clients to next, because that is where we're lacking.
Yeah. And I think attaching to what you just said, asking the question, why doesn't this exist? Why doesn't X, Y, and Z exist? If not, well, how can we make it happen? So sometimes it just starts with asking those questions, and asking the question is really scary sometimes because maybe we're afraid that someone's going to say, no, you can't do that, or why would you want to do that, or that's a silly idea. But you have to ask the question, because oftentimes if you have the question, somebody else has the question. It's time to ask it and fill those gaps in our communities. It's vitally important that we're finding ways to connect everyone. The word inclusive, like you said it a couple times, and I said it was one of my favorite words that you had on your list, but getting the opportunity to every individual in our communities is vitally important.
Yes, completely agree. You hit the nail on the head with that one. Ask the question. Go ahead and ask and just do it.
Ask the question and then hit the start button.
Yep.
Just like you did.
Yes.
And you're tired.
Yeah, and so you talked on that. Like it's hard work, but there are other people. If you're asking that question, there are other people asking that question too, and there's a need. And so you may have some pushback from people, and you may hit some roadblocks. But if you're really passionate in it, and you find those people and those clients that say you need to do this, do it. Because that's what I had. I had clients that said, no, you can't leave me. Even though the gym is closing, please don't leave. And I'm like, I promise I will find you another therapist that will do this with you. I will train them. But right now I need to work on getting this out to the population. And so just do it. Hit the start button. Ask a question. Hit the start button.
Ask the question, hit the start button. That's the theme of the day.
Yep.
Sigourney, thank you so much for your time. I have learned an incredible amount of information from you. I am really excited to get this out, this podcast out, so everybody can get a hold of you, ask questions, find you on social media, and we can just kind of share this. And let's just see where we can go with this.
Yeah, thank you so much for having me on. And again, if y'all want to find me, it's Rebound Therapy USA. Even if you just Google it, it will come up.
We will make sure it's linked in the show notes too.
Perfect.
Great.
I really appreciate you having me on, and I look forward to where Rebound Therapy goes.
Me too. Yes. Thanks for saying yes to a newbie podcaster.
Yeah, of course.
All right. We'll talk to you soon.
Okay, thanks.
The PTA Plus podcast is hosted and produced by Katie Sutton in collaboration with PT Podcast host and CEO Jimmy McKay. Thank you for listening to another episode of the PTA Plus podcast, where the conversation is for PTAs by PTAs. This show is for educational purposes only and not intended for clinical decision making. While care is taken to ensure accuracy, factual errors can be present. Become part of the PTA Plus podcast family by liking, sharing, and subscribing on iTunes, Spotify, and anywhere you can listen to podcasts.